This is Guruvayurappan. I head Human Resources Function for Omega Healthcare. I am operating out of Bangalore. Medical coding in India as a profession is growing. Of late, we have seen the additional speciality of medical coding domain also is increasing, and the post-Obama care or ICD-10, the expected growth of medical coders is anywhere between 15 to 20% in the near future, and in the next 2 years the expectation is that the current volume of medical coders will be almost doubled. The reason being, earlier the medical coding, the international coding standards had about 15,000 codes under ICD-9, and ICD-10 has got about 65,000 diagnoses. So the expected learning curve for our current number of medical coders is likely to be anywhere between 3 to 6 months. So every medical coder who can do 100 codes chart per day, because of the volume, they can do close to about 60 to 70 charts per day. That requires additional manpower to help reach this volume. That is the 20% on the short term. We are progressing US medical billing healthcare offshore providers. We focus on the provider side of US healthcare, helping the US healthcare in terms of medical billing, revenue cycle management, medical coding, and also accounts receivable management. Very interesting question. The last October was a very festival mode for us, like what years back we had the Y2K. In 2000 we were all looking at the Y2K is coming, Y2K is coming, and then Y2K came and gone. Similarly, the ICD-10 preparation in Omega was happening for the last 3 years. The October 2012 was the initial date for us to launch ICD-10, and then preparedness started early 2012, but various reasons in the US Senate it is postponed to this October. We are one of the few organizations were very successful in implementing the ICD-10 very smoothly. We didn't see any large impact. Our clients are very happy that from the day one of implementation, most of the charts we coded fine. The readiness for the preparation for the trainings started about February of this year. There was a group of trainers identified to train the current coders. We have about 2,500 medical coders to be trained as on that day. Currently we are about 3,200 coders, but when we planned in February, we had about 2,500 medical coders. So it was a marathon exercise. They were supposed to go through about 60 hours of training plus about 65 hours of on-the-job training. In addition to their day-to-day production, these people have to also get ready for the ICD-10. And our training team has done a commendable job of managing this in all the 3 locations. We have invested a lot of money on learning management systems to ensure that learning happens in both classroom as well as they have a free time to sit at their office space and then learn. We also incentivized the entire medical coders who gone through the ICD-10 to ensure that it is a motivation for them to go that extra mile to learn and then help us to implement a very smooth transition. And that incentive plan also helped us to not only increase the learning curve, but also help them to be retained in the organization. See, we saw the writing on the walls about 2 years back. The changes in the Obama care or changes in the ICD-10 happening in the US. The requirement for medical coders in India is likely to be doubling in the coming years, but the available talent is very limited. So what we did about 1.5 years back, last August, 2014 August, we launched an academy where we started creating more and more medical coders to the market. So we started training them. Any interested students can come and learn from us. And we had three-pronged approach to that. One, whatever for our own consumption, we will hire them. And we will also go to our competitors and then sell that we have a ready-made medical coders, so that there is a huge supply-demand gap for this profession. So we thought of creating more supply to the market that will help that our own, instead of competing with each other, we can complement each other in the market. We had about, as of today, about 870 medical coders we have trained. And we converted into batch on an average about 20-25 per batch we used to train them, and about 550 we absorbed. We also told them that if we are hiring, we will repay the tuition fee what they pay at the end of their 12 months completion with us. So what it has helped them, people can invest, we train them, we also give them an employment. If we don't have requirement, we will also place them. And when we place them, our competitors also, we request them that you refund the course fee, whatever they have paid. Otherwise, we would have paid the recruitment fees for them to hire. We are giving you free. So it was all along a win-win situation. We started Medical Coding Academy at Chennai last year. We moved to Trichy. So we have a Medical Coding Academy both in Chennai and Trichy today. Our focus will be to start next in Bangalore. Once we have in our own, wherever facilities are there, post that our intention is to start this Medical Coding Academy across India, so that any city people wanted to learn medical coding, we train them, and it's an employment opportunity creation. Indian medical, when we talk about Indian BPO, there are about three large segments which creates employment in Indian BPO. One, like provider side of healthcare, where we hire life science background and paramedics to do the medical coding. Then there is a other bigger side of healthcare is the payer side of healthcare, that is also getting outsourced to India, where whatever the nature of job we do, somebody have to inspect it, whether the right things have been done, whether the payment can be released. There also there is a coding professional happens. The third area where the life science graduates and the paramedics get an opportunity are in the clinical research. A lot of countries are now looking at India as a destination to help their clinical research happening back in this country. So the research is another area which is helping. There is a small percentage of people are also hired by the IT, healthcare IT companies to support as the business intelligence team. So they have their software team, but they need the domain help. Hence, they are marrying with a small group of people to do that. These are all the 3 or 4 areas where the life science graduates and paramedics are getting a larger opportunity.
Now, poised for good growth, what are the new challenges the Indian healthcare BPO sector faces in the hiring area?
In the hiring area, the largest challenge Indian healthcare BPOs are facing is the talent availability. We have a lot of talent available, but selling them that an alternative employment, because I learn alternative medicine as a doctor. I am a physiotherapist. I am a pharmacist. Now I wanted to be a pharmacist. I wanted to do a physiotherapy. But what is this healthcare BPO job is something we have to sell it. So making them to realize that this is an alternative career is one of the challenges BPO companies faces. Plus, we also see that the Tier 2 and Tier 3 cities produces the maximum life science graduates. whereas in the cities the science graduations have come down. If you look at, majority of them are moving towards the professional courses. So making them to come from that particular part of this thing, migrating them to the city and to start their career, how do we motivate them is one of the challenges. So what the BPO companies are doing now is identifying the hub where largest students base are there in whichever the rural tier 2 or tier 1 cities, and trying to set up a facility there. So they are constantly in touch with the government. NASSCOM is also talking to the government to help the IT infrastructure in tier 2, tier 3 cities, also the real estate infrastructure. These are all basic requirements for a healthcare, a BPO to be set up. I think that is the current challenges we face. We also have another challenge is that how do we attract is the easiest thing now. How do we retain them? What kind of a career path that we can create for them so that they see the larger picture, the future growth. So while we try to attract the right talent, what one or two things as an organization we do to retain them, show them the larger picture, is the next challenge the BPO companies are facing. Absolutely. So when we spoke about the previous question that okay, if I can attract, if I can't retain them, the entire objective, the purpose will get defeated. So what as latest as yesterday, we launched a program called Parivartan. What Parivartan do is that all our employees and their family members, immediate family members, are included in an initiative where they can reach out to a toll-free number. We tie up with the largest employee assistance program company to get any kind of assistance, be it on their work-life balance side, be it on stress-related, work-related, family-related. If a lot of female employees we hire, if you look at the paramedics and life science, alternative life science, 70% of them are female employees. The boys seldom go and now do BSc science and things like that. So when we hire them, when you want them to grow in the organization, the first order is to help them to feel that there is an opportunity, they can grow with us. And the female employees have a very unique way of looking at their career, because their priorities changes depending upon how their life is getting moved. There are changes of family, they wanted to post family, so how we can create. So we have an initiative which launched called Roshni. So Roshni is exclusively a woman employees to help the women employees, the people about their challenges, how do we do it. So the Parivartan and Roshni are some of the new initiatives which is reaching out not only to the employees. Now my mother wants to know why my daughter is coming late. What I am seeing some kind of a change in her behavior. She can call and take an assistance from them. So it is a kind of a online counseling, face-to-face counseling opportunities. There is a group of trained psychologists available for the help of each and every employee and the family members. When those are a couple of immediate strategic initiatives we have taken, we also looked at the training programs, as you were asking what are some training programs you have done. There are 4 training programs we have launched in the last 4 months, looking at the growth, looking at how do we create the career. So the first program we launched is called FTL, that is First Time Leader program. It's about 13-week program. Each and every supervisors in the organization. So when I talk about supervisor, how the nature of job goes. So I join as a medical coder and I need someone to supervise me. I need someone to help me to grow. So every 20 medical coders will have one supervisor, or he is called a team lead. For every 5 team lead, I will have one manager. That is how the strength. So when we grow, for every additional new 20 employees, I will have to add one team leader. In this phase, who is this team leader? The team leader is the person who is already doing this job, who has the potential to lead a group of people, and they emerge within the group. So that is a career progression we are creating. When they become a team leader, I hired them for the coding job. Now I need to help them to learn the supervisory role. So the FTL program is a 13-week program which certifies a newly promoted team leader. And we also, when we grow, we have to promote some managers. So these team leaders become managers. So when they become an assistant manager, that is an entry-level manager, we also created the training program which is certified LTL, Lead the Leader program. So Lead the Leader program is, I think we finished 2 batches already, and FTL we have finished close to about 7 batches. Closely about 190 team leaders have gone through that program, and about 40 team managers have gone through that program. The third program what we launched is called Process Coach Certification, PCC. Process Coach Certification is, now some of these floor medical coders will become subject matter experts. They know the job very well. So when a new person is joining, some assistance, I learned from my training room, but on the floor I need some support. So the process coaches are the people who become a specific domain experts, and they help them to achieve, become successful. So how the performance coaching happens on the floor is the PCC, and that we certified close to about 40 of the coaches as certified. We have more programs to be launched to complete it. And the last one is the TTT, that is the Train the Trainer program. So when we create these process coaches, when we create internal trainers, they need to understand not only their domain, but also what are the andragogy system of training, what the methodologies of training, so on and so forth. So they go through an intensive Train the Train program and they get certified. So when they join, we give them, there are opportunities to grow either vertically in the organization or horizontally in the other support functions like quality management system and training function, etc. So that is the opportunity for them to create their own career. As so they look at, oh okay, it is not that I am only going to be a short term employment, it is a career that they are creating. After this about 2 years, they are going to be given a certification program. They are all eligible to be a certified medical coder by American Association of Professional Coders, AAPC. Once they are certified coder, it is equivalent to, like in our India, a chartered accountant is a CA. So it's a certified accountant. So they can be a medical coder without a certification, but when they get certified, it's a profession. So that is the opportunity we have created for our medical coders. We have a tie-up with the AAPC, the largest certifying body in America, and we have tied up with them that 100% of our medical coders will be certified in the next 2 years. That is the business, that is the plan going on.
Thank you.
Thank you very much.